Hello, and welcome to the Blue Table Talk Show. I am host Hedrika Adley, a fourth year nursing student, and today our panelists, who are also fourth year nursing students, will be joining us to discuss the hot topic caught between a rock and a hard place, ethical dilemmas and courage. So before we get into our discussion today, we'll just go briefly into what is ethics, what is an ethical dilemma, and then concepts we commonly use when discussing ethics.
Ethics is a branch of philosophy used to study ideal human behavior and ideal ways of being. Ethical dilemma can be described as a situation in which an individual is compelled to choose between two actions that will affect that of a sentient being. Beneficence is the principle of performing good deeds. Barton Rich states that beneficence means people take actions to promote welfare of other people. Justice is treating people equally and without prejudice. The equitable distribution of benefits and burdens, including and assuring fairness in biomedical research.
So to begin, our scenario today will lead us into today's discussion. We'll be teaching a concept revolving our topic. So let's have a look, shall we? Cue scenario.
Case scenario. Libby Felton is a nursing leader of the Nursing Leaders Society in Nassau, Bahamas. She is also a midwife at Princess Margaret Hospital. On a late night, where staff is short, an active labor client is brought in through maternity ward. Libby asks the patient, Sarah Darcy, for her next of kin in the case of an emergency. Sarah provides Libby with the baby father info and contact. Libby realizes the patient's emergency contact is her husband. Shocked, Libby goes to a nursing colleague to ask for help because she is too shaken to deliver the baby, and there are no other midwives on board. The doctor is 20 minutes away, and no other relief is available at the time. What should Libby, a registered nurse, nursing leader, and midwife, do?
Wow, what a scenario. So, just off the top, this is definitely an ethical dilemma. This nurse is definitely caught between a rock and a hard place. She has to make a decision between two undesirable alternatives. One, if she doesn't do her job because of what she just found out, something could happen to the woman and, her license can be in jeopardy. Her career may be over. There's no one to help her right now. But if she does do her job, tries to put her emotions aside, and something still that is undesirable happens to the woman or the fetus, that can be seen as a conflict of interest, and her job could still be in jeopardy at the end of the day. Wow, I just want to hear some of you ladies' feedback, because this is intense.
If I were Libby, because of my duties and my profession, I would have no other choice but to deliver the baby despite my emotions at the time. I would honestly have to fight the urge not to react off of emotion. I would utilize democratic leadership. Libby went to her colleague on what to do, and based off of her colleague's response, we would have had to make a collaborative decision on what was best for the patient at the time. The leadership qualities I would have utilized would be emotional intelligence for sure, communication, integrity, and humility. Because Libby is a nursing leader and midwife within the hospital, the outcome should be the same with any mother who had just safely delivered her baby. Libby should not confront the mother in no way, shape, or form on hospital grounds. When she arrives home, Libby's husband and herself should deal with it accordingly, because although Libby would be in her home or on the outside world and not in the hospital, she still has a title to maintain of being a nurse leader and midwife.
So looking at the scenario, I think what makes Libby interesting, Libby as a nurse, leader, and midwife interesting, is that she's all these things and also a leader. And most leaders are based on our experience, our knowledge, my experience, and my knowledge, what I've came across in nursing. Leaders have some percentage of emotional intelligence. And emotional intelligence is basically just the ability to use your emotions effectively. And based on this scenario, it's a case where we see that Libby is under pressure where she has to decide what's the best outcome for the client, and she also has to look into herself and try to push past what she's feeling to bring that about. What's also fascinating about the scenario and Libby being a nursing leader, a midwife, it's just that the basis of how she started out was just by being a registered nurse. And I think we all as nurses make decisions, and then most of those decisions, because we are in a discipline, which is nursing, those decisions are based on some code. And for nurses, it's the ICN Code of Ethics. So it gives us the framework of what we should follow daily in nursing care when we're providing nursing care. And so Libby most likely will be trying to utilize some of those standards that we find in the ICN Code of Ethics, and I think that will help her to make a decision at the end of the day that is the best outcome for the client.
In this situation, as a nurse leader, I would step aside, take a minute to calm down and not get angry. I would ask for assistance. If no assistance is available, I would have to put my feelings aside the best way that I can and remind myself that I am on my job and it is morally my duty to deliver the baby. My style of leadership is more transactional, where I focus on completing the task as best as I can, and transformal, where I focus on loyalty, fairness, morality, and ethics. The qualities or characteristics I would utilize for the best outcome would be to use the moral decision-making model. I would take a minute to think about who is involved or should be involved. I would outline my options, resolve by weighing out my options, affirm and act, then evaluate my decisions. What would the outcome look like? The outcome would be where I was professional to the patient, Sarah Darcy, treat her like any other patient with quality care, deliver the baby, and deal with the situation after my shift in private with my husband.
In Chapter 2 and in Chapter 4 of the textbook, Leadership Roles and Management Function in Nursing, talks about classical views of leadership and management, as well as ethical and moral issues. Both chapters discusses characteristics of a leader, also leadership roles when faced with moral dilemmas. In this situation, as a leader, I would utilize critical thinking, emotional intelligence, personal integrity, and also emotional balance and control. When faced in tough situations, a leader should maintain competency at all costs, perform their duties to the best of their ability, and demonstrate moral courage in any given situation.
In listening to everyone's feedback, we've all been reflecting on the question, what should Libby as a nurse, a nursing manager, and a midwife do in this situation? Thinking as a nurse, first things first, nurse and midwife, you have a job, right? So I'm thinking to myself that this child is innocent. This is not between me and the mother. This is not between me and the child. I have an obligation. I worked hard. I got a license. And my obligation is to treat this woman as if I don't know anything about her and she is delivering her baby. And so that is what I'm going to have to do. I am going to have to put everything that I am feeling aside.
and do my job to the best of my ability. Now, I will say that I would not want to be in the room alone. I would want to have a witness in case, our conflict of interest comes up and something goes awry, whatever it may be. I would like another medical professional in the room, even if they cannot assist me really with the labor, so that I can have a witness. As a leader, this is very difficult because I am someone that subscribes heavily to like servant leadership, right? I want to make sure that I am putting people first, and I'm very selfless generally, and when it comes to my profession. And so I am thinking that, I would have to tap into a problem-solving process because there is a conflict here. So I would want to use a traditional problem-solving process. So there are 7 steps. Step 1, identify the problem, which we have. Step 2, gather the data to analyze the cause and consequence of the problem. Well, I am emotionally disturbed, but she's in active labor. These are our problems. 3, explore alternative solutions. There are none, okay? The doctor is not here. I got 20 minutes. She needs to deliver this baby now. I have to do it. Step 4, evaluate the alternatives. Step 5, select the appropriate solution. Help her deliver her baby. Step 6, implement the solution. Again, deliver the baby. And 7, evaluate the results, which, you're hoping for a healthy mom and baby. Now, the textbook that I am referring to is called Leadership Roles and Management Functions in Nursing, Theory and Application by Bessie Marquis and Carol J. Houston. Now, all of these tips that I have outlined are taken from chapter 4 of this textbook, referring to this one chapter. And in this chapter, on page 126, it is talking about integrating leadership roles and management functions in ethics. And something that stood out to me was the integrated leader, manager, recognizes that ethical issues pervade every aspect of leadership and management. Rather than being paralyzed by the complexity and ambiguity of these issues, the leader-manager seeks counsel as needed, which Libby did, accepts his or her limitations, which we've all discussed and decided that's something we'd have to do. Our limitation is that there is no one else available to help us right now. We have to do what we have to do and make the best possible decision at that time with the information and resources available. So, no one else is here. Doctor's 20 minutes away. I am the only one that can do this. I have to do this. This is the best possible decision with the information that I have and the resources available to me.
An excerpt entitled How Good People Make Tough Choices, Resolving the Dilemmas of Ethical Living by Rushworth Kidder states that the really tough choices don't center on right versus wrong. They involve right versus right. As nurses, we are always involved with conflicts and ethical dilemma in the nursing and healthcare field. Hence, it is our duty to reflect, critically reason, and critically think what is the best outcome for every patient. So in today's lesson, we focused on ethical dilemmas. As nursing students, we follow the ICN Code of Ethics for Nurses, which outlines the standards of ethical conduct.
We hope today's segment was very resourceful in helping you navigate ethical dilemmas and courage. Should you ever need a refresher, feel free to reference the ethical guidelines as stated by the ICN, or just stop by and watch this video again. Thanks for tuning in.